Hello everyone, welcome back to Blocking the Flame, Anakinra and COVID. I'm Gaganasri, your host. I come from a bioinformatics and computational biology background, and much like decoding complex algorithms, today we'll be decoding something equally intricate, Anakinra's safety profile in COVID-19 treatment. Just like any powerful tool, Anakinra, an IL-1 receptor antagonist, demands both precision and respect. It holds a promise to extinguish the inflammatory blaze of COVID-19, but we must also ask, does the firefighter ever flood the house? Joining me is someone who brings a deep microbiological lens to this conversation, Aseema, who has an interest in bridging the immune system, microbial interactions, and clinical relevance. Welcome, Aseema.
Thank you so much again, Gaganasri. It's a pleasure to be here. And this conversation is so timely, especially because when we modulate immune responses in a disease as unpredictable as COVID-19, it's crucial to know not just how the drug works, but how it might misfire. Safety isn't just a checkbox, it's the scaffolding around which effective therapy is built.
Exactly. So let's unpack that scaffolding. From your clinical biological lens, how does anakinra compare to other immune targeted treatments in terms of safety for COVID-19 patients?
Well, Anakinra has an established safety profile in chronic inflammatory diseases like rheumatoid arthritis, and it's generally well tolerated. However, when we enter the terrain of acute viral infections like COVID 19, things get a little trickier there. At its core, Anakinra blocks IL-1, which is a cytokine that's central to immune activation. While this can calm the cytokine storm seen in severe COVID 19, it can also dim the immune system's early alert system, and that balance is delicate. Common adverse effects include mild injection site reactions. Think of them as the body's polite protest to a needle prick. But we also worry about more systemic effects like neutropenia or increased susceptibility to secondary infections, especially bacterial or fungal, which can creep in when immune defenses are lowered.
So it's like trying to dial down the heat without turning off the stove entirely. You want to simmer the inflammation without letting infections boil over. Given that, what are the key risk factors you would say that physicians should assess before reaching for anakinra in COVID-19 cases?
Well, great metaphor, first of all, spot on. So, risk assessment starts with patient profiling. We need to examine renal function closely because anakinra is primarily excreted through the kidneys. Patients with compromised renal function might accumulate the drug, increasing toxicity risk. Then there's the infection risk as well. In COVID 19, many patients are already walking a tightrope of immune dysfunction. Adding immune suppression, even mild, can tip them over into, secondary infections. We have seen fungal co-infections like mucormycosis become a concern, especially in immunocompromised settings. And perhaps most critically, the timing. Administering anakinra too late after tissue damage from the cytokine storm has set in reduces its efficacy. But too early also, and you risk suppressing antiviral defense mechanisms prematurely. So it's like diffusing a bomb. You have to cut the right wire at the right moment.
Wow, cutting the right wire at the right time. That's such a powerful image, especially in a disease that unfolds so unpredictably. So let's talk about that tightrope walk. How do clinicians monitor patients during anakinra therapy to ensure they're balancing safety and efficacy?
Well, there are three pillars of monitoring, that is, infection surveillance, hematological profiling, and organ function tracking. In infection surveillance, daily temperature checks, respiratory assessments, and microbial cultures are done where needed. And it's important to catch infections early before they seed complications. In white blood cell counts and neutrophil levels, here, a dip here could indicate immunosuppression from anakinra. And in liver and renal function tests, especially for patients with underlying conditions, we monitor the ALT, AST, creatinine, and GFR. Additionally, even mild symptoms like localized swelling or fatigue shouldn't be overlooked. They can sometimes be early signs of systemic issues in vulnerable patients.
So it's like flying a drone through a storm where you need constant telemetry.
Mhm.
Every data point, blood count, organ function, infection markers, they all act like a sensor guiding us through a dangerous airspace. For clinicians using Anakinra, what would you say is the single most important principle to uphold?
Well, that would be individualized care. Anakinra is not a plug and play solution, it needs to be tailored to the patient's condition, disease stage, and biological vulnerabilities as well. Just like no two immune systems are alike, no two COVID-19 patients will respond identically. I would say know your patient, monitor like a hawk, and time your intervention with as much precision as possible.
Beautifully said, Aseema. And I appreciate how your microbiology background helps bridge that molecular understanding with clinical application. It brings a grounded yet dynamic perspective to this discussion.
Oh, thank you so much, Gaganasri. And your systems biology and computational insights add that necessary panoramic view, of course. And we need both the zoom lens and the wide angle.
I like that zoom in wide angle. As always, it's been such a pleasure learning with you. Next time on Blocking the Flame, we'll be switching focus to dosing strategies where IV bolus or subcutaneous injections make a difference in our COVID-19 patients. We'll decode what the evidence says and what it doesn't. And to our listeners, thank you for joining us on this clinical and molecular journey. Until next time, stay curious and stay safe.